Salam sejahtera and a good day. Today we shall be looking at the design and analysis of control experiments. Before we begin to talk about control experiments, we need to understand the three principles of control experiments, which are replication, which is actually done for precision, and of course, precision is much better in homogeneous group. Secondly, will be randomization in order to minimize bias. And thirdly, to enable us to have local control. Local control can be achieved via blocking, stratification, or various other strategies in order to address confounders. Remember, confounders are factors that we may not have necessarily identified at the outset of experiments, but could potentially affect the outcome of the experiments. Well, let's look at control experiments. Suppose you have a farmer who treated a sick cow with medicine X and the cow recovered. Can you then conclude medicine X is effective? What about another proposition of treating one sick cow with medicine X and allowing the other sick cow to remain untreated? That could be better. However, if we are only using one animal versus another animal, it may not be as convincing in the third scenario whereby we'll be treating a group of sick cows with medicine X and leaving another group of sick cows to remain untreated. So you can see here, as we increase the sample size, the convincing power of the experiments increased. Most control experiments have parallel groups rather than crossover groups, which is actually a Latin square design. You also need to remember that crossover design should not be used when factors are interacting each other. For example, protein and dietary energy, which are known to be interacting each other, affecting growth rate of animals. Or when we are actually measuring long-term accumulative treatments in animals, for example, growth rates, which is also another scenario whereby we should not be using crossover design. Crossover design should not be used when there is actually an intervention that has long or undefined washout period. So since control experiments are supposed to be conducted under a well-regulated condition, we should have a maximal control over the trial to facilitate easier data analysis and interpretation. Control experiments itself can also be a part of larger clinical trial for drug agent in order for approval or simply drug testing. So stages in testing new therapies based on the good clinical practices, a US FDA is actually outlined as follows. We can have phase 0, which is essentially a preclinical controlled trial, whereby it is done on done as a control experiment in animal subjects, followed by phase 1, phase 2, phase 3, whereby the drug or the agent is submitted for review, and phase 4, which is actually conducted when that particular agent has been approved. To take another perspective based on the New South Wales Cancer Institute, in terms of number, phase 1 typically involve anything between 20 to 100 participants, phase 2 in the hundreds, phase 3 anything between 1,000 to 3,000, whereas phase 4 may involve more than few thousands of participants and may occur over a longer period of time. Phase 4 is actually necessary because it helps us to monitor post-approval long-term monitoring. Another scenario is actually where we could be looking at development of vaccines. Due to the current requirement, the current pressing need for an effective vaccine, we have to fast track the vaccine development. Look at this example of traditional vaccine development published in Frontiers Immunology, October 2020. So a traditional vaccine development will typically take anything between 10 to 15 years, with each of these stages indicated by each of these color blocks. So as you can see here, preclinical alone can take up to 3 years, same and likewise with phase 1, phase 2, phase 3, and of course, manufacturing and post-marketing surveillance will add another 1 to 2 years. However, due to the pandemic pressure, all this can be compressed to anything between 12 to 24 months. Like it or not, we still have to incorporate the control experiments model in order to really ensure that the vaccines or the agents or any other drugs that we are developing works in the general population. So why do we need controls then? The controls actually forms the basis of comparison and to minimize bias. Ideally, we should have positive controls that is actually a treatment group inducing or showing the maximum response. And opposite to that, we have a negative group, negative control group, whereby untreated groups are showing minimum possible response. And on top of that, it will also be nice to have a baseline controls, whereby it is actually going to give us pre-treatment values in situation where each animal is actually its own control. However, this is often being abused or misused to the researcher's advantage. And of course, we also need to have parallel or contemporary control to compare against possible time-related changes or maybe co-exposure to the environment. And do bear in mind that some of these controls may have ethical issues in their own, particularly negative controls. If you are inducing a condition which could be fatal or could induce long-term suffering or extreme suffering to the experimental subjects, it is oftentimes require some degree of modification in the interest of patients or animal welfare. So when we are performing control experiments, of course, we need animal models. So the considerations to select animal models for experimental studies are as follows. First is actually as appropriateness as an analog or representative of the treatments that we are trying, transferability of information from actually one species to the human being, genetic uniformity of organisms where applicable, because different strains of animals may have different susceptibility, different response, background knowledge of the biological properties, in a simple fact, actually how to transfer or translate drug dosages from humans to rats to dogs, or from dogs to human studies. And of course, cost and availability of these animal models will be important determinant, and so do generalizability of the results itself. Ease of adaptability to experimental manipulation will be something that is also worth considering when we are selecting animal models. Of course, ecological consequences, ethical implications, housing availability, the size of the animal, and of course, that will also determine the numbers required are also important consideration to select animal models for experiment studies. And the lifespan of animals itself must exceed the tenure of the experiments incorporated. In certain toxicological studies, sex and circadian rhythm could be very important consideration for as to the accuracy and generalizability of the model itself. And depending on the parameters and the amount of data required, we may also select the appropriate animal species for this purpose. Age of animals could be very important if you are actually modeling after a specific conditions. For example, you may need geriatric animals to mimic geriatric conditions in human subjects. And to some extent as well, some experiments may require us to develop or raise progeny from a particular treatment group, and therefore we should also consider the progeny requirements as well. And the following will be the advantages and disadvantages of animal experiments. Well, of course, advantage is that there are moral and ethical legal considerations on human experimentation, which is actually absent in animals. Then there are adequate number of genetically similar animals available as contrast to human beings, and the rest of the other benefits associated with using animals. For example, better standardization, easily manipulated disease states, shorter lifespan to allow simulation of long-term effects, and unlimited access to specimens. Disadvantages mainly evolves around extrapolation of animal data to humans, and of course, there are inaccuracies in terms of translating these results from animal species to humans due to specific species variations in anatomy, physiology, and even metabolism changes. And of course, lately there will be concerns about animal welfare, animal rights that may prevent us from considering animals in experiments. Generally, the classification of animal models and statistical analysis can be related to these three approaches. First will be the exploratory model, then explanatory model, which is actually aiming to understand a more or less complex biological problem, And of course, the predictive model, when it's being used with the aim of discovering and quantifying impact of a treatment. Of course, whatever models that you use, we need to ensure that the choice of animals is actually correct. Otherwise, we may over amplify or over suppress the results and generalizability of results in human populations. Now, once we are done with the actual experiments, of course, we could be collecting the data and analyzing the results. And the techniques employed more or less depends on the design and underlying assumption of the statistical test outline. So it becomes important for us to remember that statistical significance does not equal to practical significance. This is especially true if you are modeling a biological process or fitting numbers into an equation. So once you got all the results analyzed, or what to do next after you having analyzed the results. So of course, it will become important if we can further expand the utility of the results by using it as a basis for prediction. This is actually where I'm encouraging everybody to maybe take a look at a certain prediction model that can further expand the utility of your model. So model fitting is actually an essential extension of data analysis because equations give a very precise and concise description of the data and how certain dependent variables is and or are related to the independent variables. The parameters of the equation has very useful interpretation purpose relative to the phenomena under study. And equations are models that will provide very informative framework for comparisons. And areas for modeling can include failure analysis, growth analysis, biomechanics, and many other many other areas that spans beyond that. So we shall be looking at an example of a growth analysis, to be precise, tumor growth analysis using model. So of course, just to make, in order to have to perform modeling, you also need to have a modeling software. So in this case, we shall be using a software that is actually available on trial basis from the internet for this particular lecture. And we shall be using the GOMPAS model to model the growth of tumor cells under a simulated environment using hamster cells. So you have collected the following data. So the following data are divided according to the tumor size and their growth in millimeter according to their days. So you can see here, it picks somewhere around day 14, day 12 or day 14 onwards. And it actually being described as impacted by all these factors. So where in this case, you can see is being described according to this parameter. So how do you interpret these parameters then? So suppose that you want to fit several of these known factors into this particular growth model. So assuming that alpha will be the presence of pro-tumor factors, which you have not identified each one of them, whereby you just accumulate everybody. Beta will be the presence of anti-tumor factors, whereas K will be the metabolic capacities of tumor cells. These are actually straightforward and direct examples so that you can just simply use this accumulation or aggregation of factors to do simple modeling. So using the software known as Curve Expert 1.4, you can actually model and ask the modeling software to select the most appropriate models. But since we are using the GOMPAS model, so you can actually see here, GOMPAS model actually is being given to you with this with this equation. And to select this particular equation, you need to select the goodness of fit and few other parameters that has been indicated by the model. Suppose that since we know the GOMPAS model has been touted to be the best descriptor based on anti-tumor growth factor, pro-tumor growth factor, and the metabolic capacities of the cells itself. So this actually has been presumed to be the best model fit for our data. So based on this, we can actually derive the best constants for this particular model, and that's actually how you can explain the relationship between all these parameters to their pro, anti, and metabolic capacities of the tumor cell itself. So no doubt this will actually give us much more insights into how the days elapse versus the growth potential, thereby allowing us to have a much better in-depth understanding of when the growth peaks and how this can actually allow us to explain the underlying biological mechanisms. So in this case, as you can see here, results of the control experiments is not the end of the control experiments itself. By incorporating a little bit of a modeling approaches, you can actually make further use of the data itself. Because one thing that you have to understand based on the summary depicted here is that most of the elements of control experiments have been described earlier. For example, the design and data screening, etc., which I'm not going to go through in this particular lecture. And the major advantage of control experiments is that most of the experimental elements can be designed so the experimenter can have a maximal control. As we can see in the GOMPAS model just now, you have already more or less indicated what will be the pro and the anti-tumor factors. And of course, it boils down to the researcher themselves to actually further segregate or identify what will be the contributing or the suppressing factors that affect tumor growth. However, the major disadvantage of control experiments is frequently the amount of resources and time involved, because oftentimes you need huge amounts of resources and time. And of course, only a well-studied design with a well-organized data collection will realize the value of a controlled study. And if it is not done properly, well, you may not have a properly interpreted, and thus a control experiment may not fully realize its potential. And this is essentially what differentiates a good study from a poor study.